thank you everybody for joining. Thank you also our guest speakers that are going to be talking today. We really appreciate you coming in on this call for us. I think it's really appropriate with the changes that was just made on Monday by our governor. So hopefully this will also have some bearing on where we stand with things right now. So just to let you know, part of the way we're going to manage the call today is the chat room is going to be open. So please, if you have any questions, go ahead and put them in there. We're going to mute all of the lines. And then at some point, if we need to, at the end of each speaker, we'll have staff go through the questions and make sure we capture everything there. If you do have a question that you want to bring up, you don't think about it during the presentation, but you have something at the end, you can use your hand up feature and we'll try to contact or have you come open and unmute your device at that time and let us know what your questions are. So for the group itself, I don't know if we have any ambassadors. I know we have at least a couple of board members. I'll let them introduce themselves. We'll start with Bruce.
Good afternoon, everybody, and thank you for joining us. I'm Bruce Berman. I run our foundation at Golden West College, and I'm the chairman of the board of the Huntington Beach Chamber of Commerce. We're glad to have you here today and hope you enjoyed today's business-to-business luncheon. Thank you, John.
Yep. Are there any other board members on? If you could raise your hand and we'll unmute you.
Sue Prescott is here.
Okay, Sue.
Good afternoon. I'm Sue Prescott. I represent Love at First Bite Catering. I'm also coming off of ambassador, but still trying to manage both ambassador and being on the board. Very honored to do that and happy to be here today. Thank you.
Is there anybody else, Tina?
Beth Hamilton. Beth?
Hi, everyone. Thank you for joining us today. I'm Beth Hamilton with Memorialcare Orange Coast Medical Center and proud to represent the Huntington Beach Chamber of Commerce.
And are there any of our ambassadors on the call today? Besides Sue.
Sue and Linda and Catherine.
Good morning, everybody. I'm Linda and I'm a member with the Therapeutic Writing Center of Huntington Beach and happy to be here this morning.
And I just remembered I am muting my phone so I don't get any more interruptions. So with that, I think we have
two more.
John. Oh, I'm sorry. Go ahead.
Catherine.
Tina. I'm Catherine Levestor. I am leader of the Huntington Beach Short-Term Rental Alliance and happy to be here today.
And then Sue again.
Longtime ambassador, merging or to the being a board member. Happy to be here. Thanks for having me.
Great.
So for those individuals that are on, what we're also going to be asking from you is what are some of the other topics you would like to see in either our AM Connects or our B2B, because we're trying to make this beneficial for all of our members, not just the board members, but anybody else that's on the call. We thought that this particular topic was definitely something that we're all interested in because it's how we're living our day-to-day life for the last almost a year now. So with the changes we're seeing, hopefully things are going to be better soon. We'll be hearing some of the changes coming up with our, like I said, with our guest speakers. But we're willing to listen to members and let us know what's of interest to you, whether it's in your particular sector, if it's just an area or a topic you're interested in. We know the next round of the PPP loans are coming up, so we're looking at trying to launch some things with that. But please feel free to reach out to any of the staff or myself, and so we can start collecting some of that information and determine what are some of the other areas that might be of interest to the members. Okay. So I am going to be muting my my device from time to time because we have some work that's being done here at the office, and I don't want you guys to overhear any of our construction workers as they're doing the work. So with that, I'm going to start off with our first guest speaker, which is Alice Huang. Alice is the Senior Account Manager and Donor Resource Development with the Red Cross And she's going to be talking to you about the importance of donating blood and some of the other safety measures we have to take place in this time. So with that, Alice, please proceed.
Thank you, John. Amy, if you would do presentation view for the slides.
Give me just a second.
Okay.
You have to enable editing before you can go into the slideshow.
Right.
I guess I'll just start. Thanks so much, everyone, for inviting me to this virtual Lunch and Learn. My name is Alice Huang, and I work in the Blood Services Division of Red Cross, and I'm super excited to be here and share with you more information about the Red Cross. I was just notified of this meeting yesterday afternoon, so I didn't have too much time to prepare an extensive presentation, but we'll touch on some key points. We'll talk about the importance of blood donation, what we're doing to keep everyone safe at our blood drives. We'll highlight some local recent events as well as upcoming blood drives in the city of Huntington Beach. I'm ready for the next slide. If you do power, I think, let's see.
Which view should you want? Outline view?
Yeah, no, do PowerPoint slide presentation view. Yeah, larger and.
If you click on that, what looks like a screen on your bottom right-hand
Exactly.
corner.
Click on the bottom left-hand corner.
Yeah, bottom right-hand corner. You'll see
right-hand corner,
looks like
sorry.
a screen
Yep.
next to the slide bar.
Gotcha.
To the right. One more. There you go.
There we go.
There we go. Thank you, Amy. So this is our next slide. As the pandemic wears in 2021, blood donations remain essential to the health of our communities. The Red Cross needs ongoing support of blood donors and blood drive hosts to ensure blood products are available for patients. The Red Cross Blood Services plays a crucial role in our nation's healthcare system. It is the largest supplier of blood in the US, collecting about 40% of our blood supply. As a national network, the Red Cross has a unique responsibility to meet the demand for blood and help ensure that blood is available for patients whenever and wherever it is needed. The need for blood is constant. You guys have probably heard this a million times, but every 2 seconds, somebody in the US needs blood. That's staggering statistics that translates to our need to collect more than 13,000 blood donations every day to meet patient needs. Patients that need blood products include accident and burn victims, heart surgery patients, organ transplant patients, and those receiving treatment for leukemia, cancer, COVID-19, or sickle cell disease. Throughout this pandemic, the Red Cross has seen tens of thousands of blood drives cancellations across the country due to coronavirus concerns, resulting in more than 1 million uncollected blood donations. The Red Cross has worked hard to mitigate these losses, and the need for ongoing help of blood donors and blood drive hosts are needed to ensure that blood products are readily available during this pandemic. It's important to remember that blood is perishable and cannot be stockpiled. Go to the next slide. This pandemic has caused the Red Cross to adapt its collections to include plasma from COVID-19 survivors to potentially help those battling the virus. Last year, in 2020, the Red Cross distributed over 125,000 convalescent plasma products to hospitals across the country. As the number of COVID-19 cases continue to rise, so does our need for convalescent plasma. Since October, our hospital distribution of convalescent plasma has increased over 250%, leading to a national shortage. The Red Cross began testing blood, platelets, and plasma donations for COVID-19 antibodies in June. This helps to provide donors insight into whether they have been exposed to the coronavirus. Additionally, as part of this effort, plasma from whole blood donations that test positive for COVID-19 antibodies may now help coronavirus patients in need of convalescent plasma transfusion. The Red Cross is coordinating with health and state and federal agencies to provide requested antibody test results, as well as work to learn about the virus and its prevalence in our communities. We'll go to the next slide. So we'll talk about safety. We recognize that safety is a priority for everyone included, and that's including us at the Red Cross. We want to emphasize that each blood donation center and each blood drive has the highest standard of safety and infection control. To ensure that the safety and the health of our staff and donors, we have implemented the following safety protocols, which include temperature checks for both staff and donors prior to entering a blood drive or donation center, face masks required for everyone involved, available hand sanitizer throughout the donation process, social distancing whenever possible, and much more. We also include, we urge donors to schedule an appointment to ensure that we can manage the flow of people coming to blood drives. Next slide, please. Next slide. So here are a list of notable blood drive sponsors in the city. So every 2 weeks, we are actually at the Huntington Beach Masonic Center. It's every Fridays for our regular donors. In the past couple months, we've worked with a few churches, Beach City's Community Church, the Church of Latter-day Saints, Crosspoint Church, as well as Living Spaces. Finally, I know that I think the fire chief, Heberle, is joining us on our call later, but I wanted to make sure to give a shout out to him and thank him and the Huntington Beach Firefighters Association for their help. They recently joined together with Refuge Calvary Chapel, and they hosted a very successful blood drive, collecting 119 pints of blood in one day. We're working with the Firefighters Association to plan another event coming this May. Also, we are seeking businesses to partner up to host blood drives in and around Huntington Beach. So if there are any chamber members that are interested, please let the chamber know and we can provide more information about hosting a blood drive. And that concludes my presentation. Thank you so much, everyone, for your time and attention. I know we have a little question section, but before we do that, I just wanted to mention that I know while the strain of this pandemic weighs heavily on everybody, we must continue to care for ourselves and one another. So be sure to do that. Please stay safe, healthy, and if you're eligible to and feeling well up to it, please consider donating blood or helping us host a blood drive. Thanks, guys.
Thank you, Alice. That was very informative. Hopefully we can get some folks here in our group that'd be willing to donate blood. I myself, somewhere, I have my 6-gallon pin. So have done that quite a bit in the past. Still have, I think, a little bit of a scar at one place where they used to always dig into me. If there are any questions for Alice before she leaves, please let us know what they are.
I have a question. Do you get an antibody test when you donate blood? Do they give you an antibody?
Yes, we are testing all blood donations for COVID-19 antibodies. You get the results as early as, I think, 4 to 5 days after donation on your blood donor app when you donate.
Hi, are all of these testing sites on the Red Cross webpage?
Yes, so if you are looking to donate blood, go on our redcrossblood.org website and you just punch in the zip code and you can find a blood donation center near you.
Great, thank you.
So Alice, you mentioned that you're looking for potential additional sites where you can do this. What
Correct.
sort of area size-wise do you need in order to be able to have a site open up?
That's a great question, John, and thank you. I'm glad you asked that. We are looking for, we usually coordinate with businesses. We're looking for large spaces to host our blood drives. And if you have a space that's about 12,000 square footage of space, we partnered with Living Spaces recently. They have a huge showroom So something like that. If you don't, we can always work with businesses that are interested. We have a bloodmobile that we are using on a limited basis, though we can't take too many donors on that, just because we want to ensure social distancing.
What about outside spaces? Do you have anything like tents or anything else available for
That's
use?
a great question, and it's coming up so frequently with everything going outdoors. Unfortunately, blood collection cannot be hosted outdoors. It's pretty much very similar to getting your blood drawn at the doctor's office. They couldn't do that outdoors.
Right.
And yeah, we couldn't set up outside. So just indoor spaces.
Okay.
Yeah.
Are there any other questions for Alice?
I have a question. Alice, thank you for your presentation. I'm a regular blood donor, and I go to Fountain Valley Blood Donor Center, you know, because it's there all the time, and I do it through the app. The last time I gave blood, I actually scheduled my next appointment while they were actually, you know, taking the product. So it's very user friendly, and you get that antibody test too. I feel completely safe and confident there. Can you explain like what precautions, because I know a lot of people maybe have a fear of catching COVID while they're there.
Yeah, of course. Thank you, Catherine. And thank you, Catherine, so much for being a regular blood donor. I've never heard of somebody making their next appointment while they are on the donation bed doing their donation. So
Yeah,
bless you.
I got the reminder on my phone, looking at my phone while they were taking the product out, and I was able to do it with one hand before the donation was complete.
And I mentioned quickly on my presentation, but we are adhering to the strictest safety standards to keep everyone involved safe. We understand that, you know, it's still a precarious time for everybody. We're doing, you know, what we can with social distancing, disinfecting, requiring masks and hand sanitizer. If you come into our blood drives, you feel secure that you're safe.
All right. Thank you very much again, Alice. Very good information.
Thank you.
Next, I don't know if Dr. Solomon is on because we're a little bit ahead of schedule.
John, do you want to maybe do
Yeah, he's not, Dr. Solomon is not on yet, and he has not come to the waiting room, so
do you
I'll
want
let
to,
you.
yeah, do you want to maybe have everybody introduce himself that's on?
Sure, we can do that until he comes on. We've got a few more minutes. So why don't we go around the
Amy can
Amy, yeah, since you've got control, why don't we use your screen as the invite list? Let everybody come on and just give a quick a minute summation of who you are and what you represent, and we'll go on until Dr. Solomon comes on.
Okay, sounds good. So first, I'll just go through the screen from top and go across. So first, Debbie Waynes.
Hey, my name is Debbie Waynes. I'm from the Wetlands and Wildlife Care Center. I am the operations manager / HR of the center. We are a rehabilitation center for the wildlife.
Thank you, Debbie. Alice, you can go again. Introduce yourself to everybody. Some people are new on here.
I'm Alice. I work for Blood Services at the Red Cross. Thank you so much for having me.
Thank you. Next, Doria Miracle. Doria, you need to unmute yourself.
Why don't we move on to the next one?
Okay, so let's go on to Beth at Memorialcare.
Good morning, Beth Hambleton, again with Memorialcare Orange Coast Medical Center. And we are an acute care hospital located conveniently at Brookhurst and Talbot, right off the 405 freeway. And we would love to answer any questions you might have about our services, not just locally at Orange Coast, but throughout our hospital system.
Thank you, Beth. Next, Sue Prescott.
Hello again, Sue Prescott. I represent Love at First Bite Catering. I'm also an ambassador and a board member.
Thank you, Sue. Next, we have Chris Arias.
Hi, good morning. I think it's the morning. Good morning, everyone. My name is Chris Arias with Memorialcare. I'm the Director of Business Development. Beth Hamilton is on my team, though I feel like these days I work for her and report directly to her. But it's a pleasure to be here with you today.
Great. Thank you, Chris, for joining us. Next, we have Linda Verks.
Good morning, Linda Verks, and I'm a longtime chamber and actually ambassador for quite a few years. I represent, on the board for the Therapeutic Riding Center of Huntington Beach, and we're on, we have our lessons and our arena at the Equestrian Center there at Golden West and Ellis. We provide horseback riding lessons for special needs children and adults, and we run our program with volunteers, so that's very important. I'll put in the chat box the TRC's phone number and website if anyone is interested in becoming a volunteer. Thank you.
Great. Thank you, Linda. So I'm going to go back to Doria. I see, Doria, you got yourself unmuted.
Oh, hello. Thank you. I apologize. I'm having technical difficulties. I'm sure you can tell. In any event, my name is Doria Miracle, and I'm the president and head mistress of the Huntington Harbor Junior Etiquette Program. And we provide social skills and etiquette for all children ages 4 to 15 years of age. We're very excited that we are collaborating with Sue Prescott Events, and we have some very exciting pop-up classes coming up in March. We have a March 27th, we have a family dining etiquette, and we have a fundraiser March 20th, which is a modern day business etiquette, and it's $35 per person, and that money goes directly to our nonprofit organization. Thank you.
Great. Thank you, Doria. Next, I'm going to go to Brian Gilman.
Hi, everyone. Good morning. Brian Gilman with the Spring Hill Suites by Marriott in Huntington Beach. We are open. We are serving our healthcare workers, of course, and essential workers, and we do have some special discounted rates for both of those. So if anyone knows people coming in to stay and help our community, then we'd be happy to help them. Just have them reach out to me directly. Thank you.
Great. Thank you, Brian. Next, I'm going to go to Kathleen Pratt.
Hi, all. I'm Kathleen Pratt. I'm with Workplace Legal. We're a boutique employment law firm here in Huntington Beach, and we're relatively new members to the Chamber of Commerce, but we're really excited to be here. And I'm talking to Tina about possibly doing one of these lunch and learns. So hopefully I'll see all of you all again sometime soon. Thank you.
Great. Thank you, Kathleen. Next, I'm going to go to Catherine Levisser.
Good morning again, everyone. I represent Huntington Beach Short-Term Rental Alliance. So we support taxed and regulated short-term rentals in Huntington Beach and Sunset Beach. So like Airbnb and VRBO, we want them taxed and regulated and provide revenue to the city. Thank you.
Thank you, Catherine. Next, we have Maureen Ahrens from Bob Hope USO.
Hi, I'm with Bob Hope USO, and I am the representative for Orange County. We serve our active duty guards, reserves, and the military families, both in Orange County that work in Orange County and who transit through the airport. We have a center at the airport that is fully staffed by volunteers. And in fact, I'm the only volunteer, so everyone else is a volunteer. So if anybody else is interested in joining us, we've been very busy out in the county this year, serving over 10,400 individuals. In fact, we have 2 launches coming up this weekend too. And we still have some people stuck out on civil unrest, waiting for them to get home and greet them too. Thank you.
Thank you, Maureen. Next, we have Liliana Dongo.
Hi, good afternoon. Let me take this off. It's kind of weird talking. Liliana Dungo. I'm actually a branch manager for Farmers and Merchants Bank here at your local Huntington Beach on Seacliff. I've been in the board for a couple of years now and excited to be here today. Please know if you are interested on the new second draw of the PPP, we are helping our small business clients on that. Thank you.
Great, thank you, Lily. Next, we have Sunny Kim.
Hi everyone, I'm Sunny Kim. I'm a general manager at a beautiful and brand new preschool and daycare center here in Huntington Beach, located on Beach and Mrna, called The Learning Experience. We just became members yesterday, and I'm really excited to form relationships and just continue to build within the community and my network. We are currently enrolling from as little as 6 weeks to 6 years old. We provide the highest care to our little learners. And we do have special promos and discounts available as well if you know of any families who are looking for care.
Great, thank you, Sunny. Next, we have Carolyn Ross.
Hi, my name is Carolyn. I'm the director of Care Connections Network, and we are a nonprofit organization that seeks to give older adults support to be able to age in their own homes as long as possible. And we are fairly new to the chamber.
Great, thank you, Carolyn. Next, we have Bruce Berman. Bruce, you're on mute. Let me unmute you. There you go.
Good afternoon, everybody. It's Bruce Berman. I am Executive Director of the Golden West College Foundation. We have 18,000 students at Golden West and are operating at full capacity as best we can during the pandemic. We hope to have students back on campus in the fall. Thank you all for coming today.
Thank you, Bruce. Next, we have somebody who just joined, Jess Pisani.
Yes, hi everybody. Good morning until about a minute from now. I work at Memorialcare in business development alongside Mr. Chris Arias, and as well as working with Beth and Deborah Culver as well, and Maggie on the line. So glad to be here. Thank you all for the invite today and looking forward to the discussion.
Thank you for joining us, Jess.
Thank you.
Let's see, is there anybody? Let's do John Vila.
I already gave my introduction. I'm going to pass on this right now because there's an alarm going off here that's driving everybody crazy, including me.
That's okay. So we just had Dr. Solomon join us. We also have Chief Haberly here. Hi, Chief. Would you like to introduce yourself?
Hi, good afternoon, everyone. My name is Scott Haberly. I serve as the fire chief for the city of Huntington Beach, and am thankful for the opportunity to chat with you today.
Thank you, Scott. Thank you for joining us.
Do you want to do Deborah Culver too? Have we real fast?
Yes. There's a Debbie joining right now. Is that who you're talking about?
Yeah, she's trying to speak.
Hi, yeah, I see. She's on mute. Let me unmute you. There you go.
I unmuted myself. Thank you. I'm Deborah Culver. I am in marketing for both Orange Coast Medical Center and Saddleback Medical Center in South Orange County. And we're happy to be here today. And Dr. Solomon is the medical director of Memorialcare Medical Foundation, which is also Memorialcare Medical Group. And we're very happy that he's able to speak to you all today and share some of his wisdom and insight on COVID-19 and specifically the vaccines and our efforts in that area.
Okay.
Great. Thank you, Deborah. We have a Maggie on. Maggie, did you want to introduce yourself?
Everyone, can you hear me?
No.
I think her volume's down.
How about Debbie Waynes?
Yep, Debbie Waynes just joined us. Hi, Debbie. Would you like to introduce yourself?
I already introduced myself. I was the first one who started.
Yep. So I think we got everybody.
Okay, John.
Okay, with that, hopefully the alarm will let me do my next portion. I'd like to ask Beth Hamilton to come back on. Again, Beth is a board member. She's also a senior program and community outreach person for Memorial of Orange County Medical Center, and she's going to be introducing Dr. Solomon. Beth?
Thank you so much, John. Let me just get the slides up here. Oh, of course, I'm having technical. There we go. Thanks again. As Deborah Culver said, we're really thankful for Dr. Solomon and his expertise, obviously professionally, but just a great asset to our whole organization and community. So it is my pleasure to introduce to you Dr. Adam Solomon. He leads all aspects of Memorialcare's population health, clinical best practices, disease management, and patient and family experience, including leading the COVID-19 Command Center for Memorialcare Medical Foundation's network of more than 200 sites of care located between Torrance and San Clemente. He provides all clinical oversight of COVID-19 testing, vaccination, and virtual health for the ambulatory sites. In addition, Dr. Solomon is an active member of California Hospital Association's COVID-19 Vaccine Task Force. Please join me in welcoming Dr. Adam Solomon.
Good morning, everybody, and thank you so much for having me. I'm going to give you some brief updates and answer a few common questions that have been coming up, and then I'll be open for questions if anyone has them, that I can dig in a little bit deeper to those things that interest you the most. So just a high-level look at what's going on across the state. This is as of yesterday. You see the case rate, the number of cases there in California finally starting to drop off after that huge surge. You have to remember that there are delays after an implementation of the stay-at-home order before we start to see those cases drop off. And so we're finally now 4 or 5 weeks out starting to see the results of that stay-at-home order coming to fruition on the number of cases. Unfortunately, there's even a further lag on the death rate. So you see that the death rate started to come up a little bit after the positive cases did, and we are only barely just starting to see a flattening of that right now. And then on the far right, you see the ICU beds available, and they've been steadily declining. So one of the things about this virus is that people might have a mild case that's treated at home. They might get sick enough to be in the hospital. But if they get sick enough to end up in the ICU, unfortunately, they tend to be there for an extended period of time. And that leads to a bit of a log jam in the ICUs. And so you'll see those will be delayed, similarly, unfortunately, to the deaths. We'll go on to the next slide. So the state has this scheme that they've put into place to look at what is the tier for each county. There's and they look at how many cases per 100,000 are there, and what is the positivity rate? What is the percentage of tests for someone that has a viral illness that are coming back as positive? And then it helps give an idea of how rapidly the virus is spreading in any given community. And you can see that the purple tier, which is that highest level right now, is marked because that's where we are in Orange County. So if we go to the next slide, you'll see our actual numbers for case rate in Orange County is at 46.6, and that is quite a bit higher than the tier bottom that we would see for us to get out of purple. And then our positivity rate's at 12.9%. Again, you'd expect to see that down at the 8% or less level for us to get further down. The ultra monitoring, is there a discrepancy between our highest risk, most vulnerable socioeconomic populations compared to the rest of the population to see if there's enough of a disparity there that it's concerning. But you can see on the graphs below for Orange County, things are starting to flatten off, and hopefully we'll start to see those curves come down to get us out of this purple tier. We'll go to the next slide. So current state of vaccinations, you can see that for Orange County, there were 178,000 doses that were given. About 2/3 of them were a first dose, and the other third was the second dose. They've prioritized who would get vaccinated, but this isn't an ideal situation where there is an adequate supply of vaccine. So initially that phase 1A, which was a big bucket for people that are healthcare workers right on the front lines of managing those patients, or the support staff that are helping to make sure that that care gets delivered. So this is where it started, and then they've added in age 65 and above as far as the state's concerned, and it sounds wonderful. The problem is we haven't had quite enough vaccine to provide it to all of those populations quite yet. So we've mostly really been focused on the phase 1A and our for healthcare workers, and are just starting to get into that 75 and above group. Even though the state and even the counties have said we can start vaccinating people below 65, if there's not enough vaccine, you still want to sub-prioritize it based on people's risks. And so those that are 75 and older definitely are at higher risk of severe disease. And so they should be getting the vaccination prior to somebody who's 65 and above. And then we get into people who are younger that have some chronic conditions that also put them at risk, but that's going to be based on the availability of vaccine. We'll go to the next slide. So fortunately, talking about vulnerable populations, people are very familiar with Laguna Woods Village, a senior community right in the center of Orange County with nearly 20,000 seniors. About 11,000 of them are over the age of 75, and Orange County Health Agency was able to supply them with some vaccine so that Memorialcare was able to start to come in and start vaccinating those residents that are over the age of 75. And last week, we were able to vaccinate nearly 3,000 of those vulnerable people. Very happy to do it. They were very appreciative. And now we're just waiting to see if how much vaccine we're going to get for the next round. Given that we were able to do 3,000 in 1 week, and we've got nearly 20,000 people to get through, it is going to take quite a bit of time to get through everyone, but happy to see some of these vaccinations going into our community. Next slide. For ourselves, we've supplied about 15,000 doses of vaccine. About 12,000 of them went to our frontline healthcare workers, and those are not just doctors and nurses. Those include people that do the transportation or environmental services, other people that really support the care that is being given to our populations and that puts them at risk because of the volume of exposure. We've set a very bold goal of vaccinating 5,000 seniors per week. In the end, we are very dependent on how much vaccine we're able to get from the county, and the county is completely dependent on how much vaccine they're able to get from the state. And then the state is, of course, dependent on the vaccine they get from the federal government. Up to this point, it's been a weekly allotment. The federal government tells the state, all right, next week, we think we can send you this much vaccine. And then the state, now they know, because they had no idea beforehand, it's not the same amount each week, then goes out to the different county health agencies to say, this is how much we're going to be able to allot to you for next week. And then those county health agencies have to go to the provider organizations and say, okay, we've subdivided that, and this is how much we can give to you for this week. And by the time all those things move along, you're only a few days out until that delivery is going to come, and you need to get the plans in place, start scheduling people, and get things going. So logistically, it's definitely a challenge. But we're very fortunate to have Orange Coast Medical Center and then a few of our offices right there in Huntington Beach. And as we are able to get more vaccine in our offices, that will expand our ability to vaccinate the community. Lately, we've been getting more of the Pfizer vaccine, and I'll get into that in a little bit, which is a little bit more restrictive in where we're able to provide the vaccinations. We'll go to the next slide. So just some common questions that are asked that I wanted to dig into a little bit. What is an mRNA vaccine and how does it work? And so I'll try to be brief, but if you go back to your high school biology or college biology, you'll remember that your genes, your cells have DNA which encode for what that cell is going to do. And the way that that cell works is that DNA gets translated into mRNA, messenger RNA, gets transported out of the nucleus, the heart of the cell, to what's called the cytoplasm, that outer part of the cell. And there it gets translated into a protein. The protein is going to do something. And so that's the way the cell normally works. This mRNA is a fragment of that RNA gene from the COVID virus that codes for a portion of the spike protein. So on the surface of that virus, there are these little spikes. If you've ever seen any of those pictures of the coronavirus, And that's what gives it that crown look when you look at a microscope, and hence the name corona, crown virus. And those little spikes are what attach and get the virus into the cell. So the drug companies have taken that tiny piece of RNA from that virus that would code for that protein and mixed it in with some lipids or fats. And that's what's in the vaccine. So that injection gets into your arm, stays local. That mRNA seeps into some of those cells just in the area where the vaccine occurred. And then that gets translated into that spike protein on those cells, and the body reacts to it as if it's an infection. Normally what happens in an infection, that virus comes in, attaches to the cell, injects its full RNA complement. That RNA gets translated into all of the proteins that make up new viruses, and then those come out of the cell, and then they start infecting other cells. So that mRNA going into our cells, and then our cells turning it into proteins, that's the way it all works anyway. So we're safer with this tiny piece of mRNA. It only encodes for a tiny portion of that virus that we can respond to, and that response will block the attachment point of the virus. So that's the way it works. There's no way for that RNA to become DNA. It can't go into your nucleus of your cell and convert backwards to DNA. It's a one-way route. Things go from DNA to RNA, come out of the nucleus, and they do not go back in. So I know there are rumors about this mRNA vaccine somehow altering people's DNA, and it just can't do that. It's not the way the cells work. The difference between the Pfizer and Moderna vaccines, they're both mRNA vaccines. They're very, very similar. There are slight differences on which portion of the spike protein they encode for, but it's for the most part identical. The way they prepare them, slightly different fatty ingredients to help get them soluble so they get into your tissue, but the storage of them both is quite different. So the Pfizer vaccine, to stay stable, needs to be in an ultra cold, we're talking -90-degree freezer. And if it's in that freezer, it's fine for 6 months. But once it gets thawed, then it has to be used much more quickly. And even at refrigerator temperature, there's only 5 days between when it hits refrigerator temperature and when it needs to be used before it gets thrown away. The Moderna, which we don't want to do, the Moderna vaccine is stable at regular freezer temperatures. So it's able to be kept in more normal freezers that are more readily available in our offices. And if that is put into the refrigerator, it's good for a month. And it has to do with those stabilizing fats that they have in those vaccines. Neither of them have any preservatives in them at all. People worry about preservatives in vaccines, and there aren't any in either of these. But overall, otherwise, the only other main difference between these two vaccines is when the second dose is recommended to be given. For Pfizer, that's 21 days or 3 weeks after the first dose. And for Moderna, that's 28 days or 4 weeks after the first dose. But otherwise, they're relatively similar. The reason for 2 doses is this. The first dose will stimulate a response. But sometimes after a first infection, the response that our bodies have is just enough to clear that infection, and it may or may not be very sustained or robust. It's just enough to clear the infection out. And with a virus, when you get the viral infection, it keeps spreading, right? The virus replicates and it goes and infects other cells, and you have to fight them off, and it's a bit of a larger process over time than the vaccine, which just stays local. It presents some of this spike protein, your body responds, and it's gone. And so the idea is then to have that second dose, and then your body sees it again, and now it's primed. So that second response is even more robust, and the body is going to think, oh, we might be seeing this again. We really need to be prepared for the future. And so that sustained immunity comes from that second dose, and that's the reason why. We still don't really know if that will be adequate. The coronavirus, this virus is what we call the novel coronavirus. It's different than the normal coronaviruses. Every year, people get an illness that they think is influenza, the flu, but it could be the coronavirus. Not this new novel one, but the regular coronavirus that comes around. And historically, you could get the coronavirus and get the flu this year, and then next year you could get it again. So the question is, with this novel coronavirus, is that the same? Is it possible that you get infected once and then you could get it again? So that's also why we're looking towards making sure there's a booster and then trying to follow over time. How does that immunity last? Does it stay around or does it start to wane? Will this be something in the future we'll need to give yearly or every 5 years or something like we do with tetanus, for example? Or is it just this 2 shots will be good for this specific virus from now on? Questions about, well, now that I've got the vaccine, do I still need to wear the mask? Do I still need to social distance? All of that stuff. 2 reasons why the answer is yes, you still need to do all of those things. One is even after that second dose of the vaccine, there's this delay until your body's immunity ramps up. So just because you had dose 1 doesn't mean you're now immune. And just because you've had dose 2 doesn't mean you're completely immune yet. It still takes a good 2 to 3 weeks for your body to make the kinds of antibodies that tend to be very robust against future infection. However, the other reason to continue, so then you would think, well, after 2 to 3 weeks, then I guess I could stop doing all this stuff. The other thing to be aware of is the studies that they did looked at a population, either 40,000 people in one study, 60,000 in another study. Half of them got placebo, half of them got the medication, and nobody who was giving the vaccine or giving the shots or getting the shots knew which one they were going to get. And they watched to see how many people got sick, severely sick from the coronavirus. And it was very clear that once they got that data, it was looked at by a separate party who could see and unblind and to see, is there a big difference between group A and group B? Is it enough to be statistically significant? Like unlikely statistically that these are the same group, that there's something actually happening from this treatment of this group that's different than in this group. And clearly it was the case. It was 95% effective in preventing people from getting very sick due to a coronavirus infection. Does that mean you can't get infected? No, that's a separate question. So the potential is the vaccine will keep you from getting sick 95% of the time. So remember, about 5% still could get sick. But for those that didn't get sick, did that mean that they didn't get infected and clear it quickly without getting sick? Because if that's the case, the potential is for them to get infected, be able to spread the virus for a few days, clear it out and not be sick. And then those around them could be infected and they could get sick if they've not been vaccinated. So very long way of explaining that even if you've been vaccinated and you received your second dose of vaccine and 2 or 3 weeks have passed, until a broad enough percent of the population has been vaccinated or been sick, people should still be protecting everyone else through the masks and social distancing and hand hygiene and all that. Should I get vaccine if I had COVID-19? This is a question that comes up quite a bit. It's very clear that if you've had COVID-19 and that your likelihood of getting sick again within that first 90 days is very low. And it probably extends even further to potentially 6 months. So there's not a rush to get vaccinated if you've had COVID-19. There's no reason you can't get vaccinated, and at some point you should. And the reason is that, again, with that viral infection, it has those spikes on them, but when you get infected with the whole virus and your body responds to it and clears it out, the antibody response and the cellular response to clear that infection may not be against the spike protein. It could be against other portions of the virus. And that might just be enough to help you to get it cleared, but it doesn't prevent it from latching on and infecting your cells. Those types of antibodies that block the key, that spike protein that latches on and gets the virus in, we call those neutralizing antibodies. And some people that get infected with the actual virus don't produce a lot of those neutralizing antibodies. So with the vaccine, we know you will. So the idea is even if you've had a COVID-19 infection, you should still get the vaccine because that will prevent you, that will give you those neutralizing antibodies to prevent you from getting infected, hopefully again. So then I want to leave it open and see if there are any questions from the audience or the moderators that you would like me to answer that I didn't get to in what I mentioned so far.
Thank you, Dr. Solomon. I'm John Villa. I'm the interim CEO for the Chamber of Commerce. Just a couple of quick questions for you. What about the other strains we're hearing about from Great Britain and so on? Will the vaccine itself have any bearing on the new strains at all?
Yes, so anytime there's a viral infection passed around from person to person, the replication of its genetic code is always potentially prone to error. And sometimes those errors mean the virus doesn't work as well, and sometimes those errors mean something about the virus just by chance does work a little bit better or differently. So these strains that we're hearing about, it's the same virus, but they've got a few genetic changes in them. Most of them don't really matter, but there are a couple that do seem to matter because they affect that spike protein. Some of them make that spike protein attach a little bit more strongly, and they make the virus then a little more infectious. So if it's spreading more, and we've seen that in the UK and in South Africa, where those, and even in Brazil, there's another one, where those viruses, those strange strains seem to be more infectious. It's still open to debate whether they are more lethal or whether they cause people to get sicker. But if you spread more quickly over a larger population, even if the percentage of people that get sick or pass away is the same, the absolute numbers can sometimes go up. The good news is it appears that these vaccines do seem to have reasonable efficacy against those strains that have been looked at so far. And on top of that, both Moderna and Pfizer are looking at altering the mRNA protein sequence slightly so that they will cover those strains as well. This is one of the great things about this new method of making vaccines. The old method took a really long time to have the production. You had to grow all these viruses. And if you wanted to change anything, it was going to take again, months and months and months and months. Whereas with an mRNA vaccine, they just simply change what they're producing and boom, you've got a change in the vaccine that can adapt. The only other thing about these viruses, this change in the spike protein that's been interesting is the testing that we do looks for that spike protein's RNA, it's amplified, and that's how we detect the infection. Fortunately, the PCR tests that we use check for 3 different locations, but one of those locations on just a few tests is for that area that got changed. So they can see that this is that kind of virus because all of a sudden there's a dropout in this one fraction. These other 2 are positive. So we know there's an infection, but this one's not there. It's probably this new variant. We've had it in this country. It's already pretty spread, but it seems that it's going to be covered by the vaccine.
Great, thank you. And one last question, then we'll go off to the members and see who has any questions for you. Athena, what can you tell us about the app? Evidently, we've been hearing some things that there's some problems with the app, people being able to log on, being able to get information out immediately or correctly. Can you address that?
Only slightly. The Athena app was brought out by the Orange County Health Agency. They were really working in a very short time frame, but with very reputable companies to develop an app that could help people put in their information so that they can get stratified according to their risk, and then they could register for their vaccination and follow up with their vaccination. It was a great attempt, but they've been running into some challenges. Anytime you develop short software in a very short period of time, sometimes challenges show up. The state, though, also has been working on their own app, and I think they're in testing right now. I think they released it in Los Angeles County, and they're going to be releasing it more broadly. But we have not been using the Athena app with Memorialcare, but it is something the county's been using. That's all I can say about that.
All right, thank you very much. Now we'll go to the attendees. Anybody have any questions for Dr. Solomon?
Debbie does. Debbie? Wayne?
Yeah. Hi, thank you so much for talking with us today. I just want to like clarification about after you're fully vaccinated, like after you've waited the period of time after the fact of the second dose and everything, if I, for example, if I'm worried about transfer or getting my mom sick, do I need to worry if I've been fully vaccinated, waited the proper amount of time to be around her? Do I still need to worry that I could get her sick?
So it's still a little unclear. Your odds of getting her sick are far, far lower after you've been vaccinated. If you've not been around somebody who is sick or is going to get sick, because the reason for this virus being so transmissible is after you get infected, the average amount of time it takes for someone to develop symptoms is just over 5 days. So there's this period of time between 2 and 7 or even up to 14 days before someone becomes symptomatic. And that's if somebody hasn't been vaccinated. So with the vaccine, and now you've got this immune response, you should be able to clear this virus out more quickly. It definitely won't make you sick. Whether or not you could get it in your system and then expose somebody is still unknown. But if you haven't been around anybody for those first several days prior to visiting, your odds of transmitting the virus after that vaccination are very, very, very low.
Thank you.
You're welcome.
Anybody else?
I did have one question. I put it in the chat box, and I don't know if you'll be able to answer it, though. It's regarding currently the only way that people can register for the vaccine is online or with a smartphone. So I work with a lot of older adults who do not have access to technology. Do you know if they're going to be implementing a phone number that they could call to get into that system? You may not know that, though. I know you said you have limited knowledge on Athena, but I just thought I'd throw it out there.
Yeah, I'm not sure how the county is going to go about any kind of expansion in their scheduling. For Memorialcare, we're using our electronic health record, EPIC, in order to be able to schedule people to get vaccinated. But I can't tell you how the county isn't necessarily normally set up to receive large volumes of phone calls. And you can imagine if you put out a phone number for the vaccine, there's going to be a tremendous amount of volume of people calling in. And I'm not sure they're set to handle that. So, I'm not able to answer the question beyond that. But I did want to add some additional resources. If you take a screenshot or you're able to save this, I'm not sure if these will be sent out to people to look at. But there's some great additional resources there if anyone wants to look into things a little further.
Yeah, we can provide that information to the list of attendees. If not the whole presentation, at least Amy or Tina, if somebody wants to do a screenshot of that, we'll just do this one page and get it out to everybody.
And John, I can certainly make a PDF of that page and make that available to Amy and Tina so they can distribute to the folks on the call. Is that okay?
That'd be great. And what we'll probably do is get it out to all of our members, not only the individuals that are on the call today.
Great idea. Great idea.
John, there's, I think, one more question.
Okay.
Someone had in the chat box. What's the current rate of people getting vaccinated? Is there currently a shortage of vaccines available for the public?
I can't tell you what the vaccination rate is right now. It's unfortunately quite low, and we are still struggling with vaccine to be able to give to the public. That is Memorialcare is actually ready. We've got the infrastructure. We're prepared to start vaccinating, and when we got that, when Laguna Woods Village was able to get some vaccine, we were able to provide it. But even with that relationship, we don't know next week if we're going to get vaccine, how much vaccine we're going to get, and whether it's going to be Moderna or Pfizer. It's currently just week to week, and it's been a bit short.
Okay, thank you. And then I think Bruce has a question. Bruce?
I do. Doctor, is there going to be enough vaccine for second shots?
So they have promised that, so anytime anyone gets vaccinated, we have to report it. They're closely monitoring how much vaccine do you have on hand and how many people have you vaccinated. That number of vaccinees is being monitored because they will match that same number of vaccinees with the same type of vaccine for their second doses. They've been very clear for us, do not hold back any vaccine, give it out, and we will get you the second doses for everybody. So the second doses shouldn't be a problem. It's the first doses right now that are the issue.
Thank you.
Is there any fear of the extension of time between dose 1 and dose 2? Because I know some of them are 2 weeks, and then one of them is a different time frame.
Yeah, Pfizer's 3 weeks, Moderna's 4 weeks. If you go a little longer, it's fine. They actually recently, CDC said even up to 6 weeks is okay. And beyond that, they say if it gets delayed even further, you don't need to repeat the series. Ideally, it's within that 6-week time frame.
For the treatment of COVID, are you doing the Regeneron, the antibody cocktails, or are you doing what else with the plasma?
So in the outpatient setting, the only real treatments are the Lilly and the Regeneron monoclonal antibodies. And the inpatient setting, you have remdesivir and steroids. You can get a few physicians and scientists arguing about the value of the monoclonal antibodies, and those might even become less valuable with these altered strains because they're monoclonal, right? They only attach to one specific spot, and if that spot changes, the monoclonal antibody doesn't work so well anymore. It's hard to get the monoclonals. There's a whole bunch of complications into being able to infuse them and how you infuse them and how long it takes, and then exposing people. We've been able to arrange something through a home health agency that can do it in people's homes, but it takes a few days. So by the time it gets there, they're already probably past the point where it really was helping or could have helped anyway. There's not much else to do if somebody's not admitted to the hospital. If somebody's in the hospital extremely sick, the remdesivir does help shorten the length of stay, and the steroids do help as well somewhat, but they are not useful on the outpatient side for someone with more mild to moderate disease.
Bruce, did you have another question, or you?
No, I'm good. Thank you.
Well, I have a question. Yep. Dr. Solomon, before you say adieu, can we get a group shot with everybody and you and everyone's smiling faces? Is that okay with you?
Sure. I hate to say this. I'm supposed to be on CBS News 12:30. I need to go.
Yikes. Okay, no worries. You get going. I'm sure that folks have captured some photos, so don't worry about that. Thank you very, very much for your time and expertise.
Thank you, Dr. Solomon.
I appreciate the invitation. Thank you so much.
So thank you, everybody. So next we have Chief Haverl. Chief, are you still with us on the line?
Yes, sir.
And correct me if I'm wrong, you are a relatively new chief of the fire department for the city of Huntington Beach. Is that correct?
I'm coming up on a year. So what?
Yes.
Yes.
Between you and Mr. Chi, what a heck of a first year you guys have had.
Definitely, yeah, definitely was. It's been challenging, but in a good way. I mean, we have some great people here, so I think our 1HB concept is working, and we're getting a lot of good work done. It's just not the 90-day plan I had in place when I started, but that's, that's okay. I think leadership, in that respect, sometimes you don't always get to pick that, but I think as a department, everybody's really done a great job of responding to it. So I'm definitely proud of the work.
Well, from what I understand and talking to a lot of the folks in the fire department and in our other services that we have out there, you guys are doing a great job. So thank you very much. Really appreciate it, what you do for our city.
Thank you for that.
So with that, I'm going to let you go on and begin your presentation. Again, we'll be having, we'll ask questions at the end. So if you have any questions, you can put them in the chat. We'll make sure that we address those at the very end. But Chief, the floor is yours.
And so, so I'm going a little bit old school. I don't have a PowerPoint with that because I think you've seen a lot of the statistics and models. What I want to do is just chat a little conversation about how the response grid is happening in Huntington, how we're doing that from an operational perspective, and talk a little about the vaccine and how that initially rolled out. I thought Dr. Solomon did really a fantastic job of explaining the mRNA and how it works and the process associated, and really kind of dispelling a lot of the concerns people have associated with that. Is really pretty revolutionary of what they're able to accomplish now, and the time and the speed, and so of getting the vaccine out. And so to talk a little about our response, initially when COVID started, we didn't see a huge COVID response back in March and April of that year. What we saw was we had a really strict stay home where people were home. Traffic wasn't on the street as much. We saw a lot less traffic collisions. People weren't out and about in a normal way that you would happen. So in essence, in the beginning, our call load actually dropped a little bit. and meaning that we weren't responding on as many emergency calls because people were initially staying home, working from home. It was much more of a dramatic initial start. However, though, as time went on and as we started to kind of open up a little bit more, we started seeing more of those calls come into play. And where we saw really the most was in the coming into the fall of this year, where we saw really the largest spike. At our we ran probably 4 to 5 positive COVID patients a day on average, moving up into the fall. And then once the fall hit, coming around Thanksgiving and the surge from the holidays, we were going as high, we were doubling that and sometimes tripling that number on a daily basis. And these are people who actively have COVID, who know they have COVID, they've tested, they've gotten sick enough to where they need to be transported to the hospital. However, we were transporting COVID-like symptoms constantly, where people are flu-like or having those symptoms of fever. And what we kind of saw over the summer and moving into the fall is we would see more of a singular response, meaning that I have a fever, and then we went from having a fever and general malaise and headache, then we went from fever that to congestion to cough, so we started seeing like more and more symptoms as the time went on. So in essence, people just slowly getting sicker. Typically with COVID in the first 5 to 7 days is when you're going to, after your exposure, you're going to start to see some of those symptoms come into play. Your body starts to work on the virus, as Dr. Solomon talked about, and break it apart. If it is going to do that, you're right around the 10 to 14 day mark is when you start to either get better or you start to get worse. And so we started seeing people after about the 2 weeks, and this is just more anecdotal for us, after about the 2 week mark, that's when you started seeing more hospitalizations for some of our patients. And some of the people that we were bringing to the ER where they were sick maybe 7 days ago, and then now they're getting admitted, 7 days later, and getting a little more advanced treatments. The treatment they've been using, and he spoke a little bit about that, has been, quite frankly, it's been impressive what it's been able to do. And however, it takes time in the emergency room. And so what we started to see coming into the fall is we started to see longer patient offload time. So we refer to that as APOT time, and it's the ambulance patient offloading. And so when we get to the emergency room after you've called 911 and we transport you, the time it takes us to take the patient from the ambulance into a bed in the ER and then transfer that care to the nurse or doctor, we track that time to the minute. And that's something that is it's an efficiency scale for us, because we want to be able to know that when you call us, we're there within usually less than 5 minutes. From that time on scene, we track how long we're on scene, how long it takes us to get to the hospital, and then how long it takes to offload. So we know from your 911 call to the time it takes before we're transferring you to a doctor, we track that every single minute of that all the time. What we started to see is the offload time increasing, meaning that the more patients that are in the emergency room and the more patients that are in the actual ICU, it slows down how fast we can process patients to a doctor. And so our offload time normally in Orange County is actually quite impressive compared to other counties. We're usually 15 to 20 minutes on an average, which if you think about the idea of pulling the back of the ambulance, taking them out, finding a bed, getting you into the bed, transferring that care, talking with the doctor, rehooking up all the new technology from ours to the hospitals and running through that process, 15 to 20 minutes is very fast. So we started seeing the offload time slowly start to increase to the point where they were at anywhere from 60 minutes to 3 hours. And so 3 hours is quite some time. And so what the hospitals did a fantastic job of is if somebody was critical, if somebody was a critical patient, we were able to get them offloaded quicker. Somebody that wasn't critical, meaning they weren't immediately in danger of life, then we would monitor them, treat them in the ambulance, and kind of wait in line in essence. And sometimes that would take 3 to 4 hours to do that. So what we did is in the fall, we really anticipated that this surge was something that we discussed, and it was something that was discussed in our circles about if people start getting together, you could see more cases and then you could see more challenges. So what we did is we put an additional class together of ambulance operators, and then we hired an additional almost 20, I think about 25 ambulance operators in the fall, right around October, early November, just anticipation of what may happen. And because that came to fruition, we normally run here in Huntington 4 24-hour ambulances and 2 day cars. What that means is that 24 hours a day, we have 4 ambulances that are in play. We have kind of our own ambulance company here. And then we have 2 day cars that run a 12-hour shift that's designed around our busiest time. So we're running 6 ambulances, but 4 are 24 hours. At the height of this, and what we're currently still running is we're running eight 24-hour ambulances per day. And the reason is what we want to do is as ambulances take longer to offload to the hospital, we need to have backups in play to run them. And the system has worked really well for us. And then having those people ahead of time and having that plan in place, we were able to kind of, in essence, enact it quickly. And then as a result now, when call 911, we weren't running out of ambulances, but we were at the point where, we could have 4 ambulances sitting at the hospital for 3 hours or 5 ambulances at the hospital for 3 hours. So we kept increasing the amount of ambulances based on the call response. And right now we're running 8 24s. And that seems to be the number that allows us to have available ambulances, that allows us to rotate through the hospitals. Now, the good news is, since what we've seen probably in the last week, specifically last 5 to 6 days, is our ambulance transport times have really gotten a lot faster. And so the majority of time we're hovering around the 1 hour mark to 30-minute mark, which is a good thing for what we've seen in the past. And additionally, we're seeing more sporadic use. So when we run the numbers and look at the data, we're seeing maybe 2 to 3 hospitals now in Orange County are running a 2-hour wait time, and they might get hit all at once. And then other hospitals are back to the normal wait time. So it allows us to shift and move patients to different hospitals in order for the wait time. So if you're transporting one of your loved ones to the hospital and we decide to change hospitals en route, it's because we know ahead of time how long the wait time is at the other hospital, and we may shift en route and get to one where the patient can see a doctor sooner. And so we do that literally on the fly all day. We actually brought in a chief officer, and part of their job is to manage the 8 ambulances, where they're going, the hospital offload times, communicate with all the hospitals, communicate with the ambulances to kind of improve that efficiency. And we were running that model for about probably the last 4 weeks. And it's worked really well for us to kind of manage how fast things change, because the reality is it's very hard to predict who's going to go to the hospital, when, and how. And so normally if you go on normal times, we know what that number is. But right now, because it's a little more unpredictable, it allows us to pivot much easier. And so that's worked really well to be able to get patients to see doctors quicker. So sometimes you may, if you've heard from someone, they said we were going to Hoag and then we diverted to a different hospital, it's because Hoag may have an hour wait time or 2-hour wait time, and another one has a shorter one. And sometimes we have to make those decisions on the fly. And this way you get the best care the quickest. But we've seen, now we're starting to see definitely the hospital wait time decrease significantly. I think the hospitals did really a fantastic job. If you think of how challenging it has been for our healthcare workers to sit there and they're working long shifts, they have people that are very sick, and they have 2 to 3 times the amount of people that they normally treat. And they're really doing that with their head down, working hard and focusing on that. And that's something I think we should all be proud of them. And anytime you know anybody in that profession, please reach out and let them know, because it is kind of a thankless job at times for them, because they are working. If you're in the ICU, you normally have 1 critical patient, now you have 3. And that's very difficult when you're tracking someone who is very sick. So the hospitals have really done great, and we've watched them pivot as well and working together with us. And so that's been a great collaboration moving forward. But we are seeing that drop, which is, I think, is something to be grateful for. And we're starting to manage a little bit, meaning that we can actually start reducing the ambulances per day, which is, I think, would be a great thing for us to see that. We are kind of waiting a little bit just to see if there is anything associated with Christmas. You look at the 2 weeks after, the 3 weeks after, and we haven't started to see that spike. What the California Department of Public Health is still telling us, by taking away the stay-at-home order and going back to the traditional tier system, which they called it a blueprint for a safer economy. Now that they're going back to that, their experts are saying we should see ICU drop in the next 3 to 4 weeks, the amount of people in the ICU. Now, right now, we're at still 0% in Southern California, in the region that we've been identified. Other area regions in the state are back up above 15, which is great. We have to be above 15% for up to 2 weeks, with a couple other factors in there for us to go back to the red tier, which is what we were back in November, or I guess it would be October, November. And if we keep on this trend, that's a great thing. I think what Dr. Solomon showed was we were 47 per 100,000 population. That means every day 47 people are testing positive for 100,000. Back in November, like November 5th or 6th, we were at 6 people per day for 100,000. And that put us in the red tier. So we went, at our height, we were at 109. So we were at 109 people per 100,000 testing in the middle of December, early January. And the positivity rate of people getting sick and being hospitalized was obviously dramatically different. So now we're down at 47, That's what they call a 7-day lag. We try to look at numbers on a 4-day lag. We look at a more consistent numbers, and that shows us we're still close around the 60s, but it's going down. And that's really what we want to watch. The challenge is for us to get to the red, we've got to be down below 7. And if we keep at this rate, that's a great thing, and we should start to see that. However, it doesn't take away the fact that I think we want to make sure we keep reinforcing how important the masks are, how important social distancing, and how important it is to stay out of the large gatherings. And if you are going to be there, make sure you're masked up, make sure you're following all of those protocols, because that's really what's going to help keep this number moving down. So back on the fire component, right now we're watching to move through what that looks like for us over the next couple of months. I am, like I said, I'm optimistic that we're seeing those numbers go down, and we're starting to see that in the field. Some of the trends that we started to see, which are kind of interesting to kind of bring to your attention, is that a lot of times when COVID, if somebody in your house tests positive for COVID, the CDC really has some good information on the website about how to act within your home so that you can prevent it from running through your home. When you're living in the same house with someone who has COVID, there are some practices you can do, where you're wiping surfaces down, you're trying to keep them isolated into one room or one location, making sure that you're not just running it like when somebody has the flu. It's much more contagious than that. And so what a lot of times we were seeing is that we would have maybe a spouse that would call 911, we get on scene, and while we're treating one spouse, the other spouse, as we find, is just as bad, and we end up transporting both to the hospital. And so it's one of those things where if someone has it in the house, we'll make sure that they're wearing their mask, make sure you're monitoring their temperature, making sure that you're doing things, if you can, isolate them into a separate bedroom. And the CDC has some great guidelines you can look at, and we'd really encourage you to look at those and follow those. Our HB Ready website we have also has that information that you can go to, that's kept very up to date in that. So that's one trend that we started to kind of see. Another one we started to see is that people are kind of embarrassed if they have COVID. And so when they call 911 because they're not feeling good, they're intentionally not telling us they have it. And it's really important that our firefighters are in houses every day with people infected with COVID. We're running calls every day right next to people with COVID. And we're wearing the proper equipment and the proper PPE to keep our people safe. We've been able to maintain that throughout the entire time, and our EMS team is absolutely fantastic at what they've been able to accomplish and move it through. If you see, our testing rate in the fire department is actually very low in compared to most agencies. And so, but I think we want to encourage people, we're not here to judge you, we're here to help you, and it's okay that you have it. We're not going to treat you, you're not going to, I would say, treat you any differently. We try to take what's called universal precautions, but it's really important, if you have it, you've tested positive, notify people that you've been around 2 days prior to symptoms. So when you have symptoms, you're contagious up to 2 days prior to that is kind of the rule of thumb we use to be most conservative. And you want to let them know, hey, I have got symptoms, I'm getting a test, and I want to give you a heads up. And we try to try to encourage people to let other people know so that they can start to quarantine a little bit, and they can wait. When you get the test results, you communicate with them. And if you're positive, then you know that you need to take your temperature each day, and you need to be a little more careful about who you're around, and you need to make sure you're wearing your mask. And, and I know it's a little bit of anxiety that comes in there, but I think it's important to understand that ignoring it or not telling people, it has a much more devastating effect. That if you're around someone, just let them know, hey, I've got symptoms this morning, I have a fever, I've got a sore throat, I went and got a test, I want to let you know, and I know we were together, yesterday, but if you've got masks on and maintain your distancing, it's a lot, I don't want to say easier, but if you've done that, then you have less to worry about. And less to be concerned, right? So if you're following those, it kind of helps. But it's really important that we've seen a few people that are, I guess I would use the word embarrassed or don't do anything. We get it, but it's okay. Let us know so we can make sure we give you the proper care and that we're taking the right precautions. I think with that, when we went to the new tier, just kind of briefly, that's the retail indoors, 25%. Restaurants can be outside now, and have outdoor dining. Hair salons and barbershops can open up with modifications for some of the chains. The gyms are still outdoors, churches are still outdoors with modifications. Bars and distilleries are still closed. Amusement parks are still closed. And then, the zoos and museums can work kind of outside. And I think the goal for us is, as we keep moving forward as a community, one thing I've been, there's a lot of things I've been very proud of. In these difficult times, I think you have options, right? To act, to lead, to get out in front of that. And I think our community and the support and all of the positive things that I know I've experienced from fire, of us working together and doing that, has really been pretty phenomenal in a very difficult and challenging time for everybody. We know how difficult this is for your family, for your loved ones, and your businesses as well. And it's just amazing to see so many people pull together and so many people work hard. And that's something that I just want to say how much I appreciate all of your support for all the firefighters and what they've been doing throughout this entire time. It's really an incredible family to be a part of. So thank you for that. And I wanted to keep it a little bit close to what we were doing. And if there's any questions you have, that I'd be happy to answer those.
So Chief, first, thank you very much for what you and the rest of your force does for us and does for the city. Very much appreciated. I know that we've got a great fire department. They're listed in the top 100, not just in the state, but in the country. And we really appreciate, again, all the work and service you do for us.
Thank you.
So with that, if there are any questions, we'll open it up to the folks on the call.
Bruce, did you have a question?
Yeah, I was wondering if, looking at the statistics and the way that they're running now, when, and if things stay the same, when would you anticipate we do get moved to a red tier if a person is thinking about opening services or something?
It's a great question. And I think at the rate it's dropping, the rate it's dropping now, it's a great sign. And couple that with the vaccines coming out. Just as an example, one of the larger fire departments in LA vaccinated 3,900 firefighters, and no firefighter 10 days after the first round of vaccination, none of those firefighters came down with COVID post 10 days, which is when they were running almost 50 cases of new firefighter COVID cases a week, and sometimes a day in that department. And after that, it slowed dramatically down. So I think combining with the vaccines and the rates going down, and people, I think Thanksgiving was a huge wake-up call for people when getting together. And I think people are now, I don't want to say taking it more serious, but a little more eye-opening of what that can do when we get together. And so I'd say if that continues and that behavior kind of continues from us from society, and some of the new things that are coming out quickly, that means, we're in the spring, we're moving down a lot faster. I don't think it's going to be I would be really guessing to give you a date, but I don't think it's going to be in the next month or two. But it dropped. I mean, it's 50% almost down what it was in December. The cases per 100,000, it's almost a 50% drop, which is really incredible, and so I think if we continue on that pace, we're going to be in a really good spot. I think the ICU availability will start to open up more in Southern California here in the next 4 weeks. And that's what all the information we're finding out. I wish I could give you a better time, like to tell you March or April. Looks like that would happen, but it's been so unpredictable now to this point. But if I trend what we're doing, we're really moving in a great direction. It just hopefully.
Thank you.
Any other questions from the members? Bruce, go ahead.
Bruce did.
You're on mute.
Chief, for better or for worse, Huntington Beach has had a problem with people wearing masks and social distancing, especially on Main Street. Do you see any change in that?
Great question. So our CERT team has been out every weekend on Main Street handing out masks, free masks. I think we've handed out over 10,000 masks, if I'm not mistaken, in the last few months, just trying to encourage the behavior. Honestly, I don't see it changing a lot in that respect. I think there definitely is strong opinions on either side. We just continue to encourage people that it makes a difference, it helps. And you're wearing the mask for other people more than yourself, to protect other people. And we just continue to kind of post that message. I'm hopeful. I've seen a little bit of a difference for sure, especially in the last few weeks. I started to see more and more of that walking around and people kind of doing more of that. But I think that will be a continual challenge for us to discuss. And that's in a lot of cities, though. Huntington Beach isn't specific to Huntington.
No, I wasn't suggesting it was, but Huntington Beach is our city.
Totally, I agree. It is definitely a national discussion on what masks look like and where they're at. But I think that that it's one of those things where if it makes a little bit of a difference or an impact in any way, shape, or form, for me, that's enough for me to do it.
Right.
Our policy here is all the firefighters wear masks. If anybody was in this office with me, I'd have a mask on. But all our firefighters wear them in the stations, everywhere they are. Obviously, they take them off when they eat and they separate when they eat to maintain our workforce continuity. But they wear them inside in the stations every day is what we've done our policy. So if you're in any one of our fire stations, you'll see masks on, you'll see them on the engines. And we just want to do it as an example for everyone else.
Thank you, sir.
All right.
I think Beth has a question.
Thank you. Hi, Chief. I wanted to ask a quick question regarding the Gothard site, and forgive me if you mentioned it. I got sidetracked because I got a text about the Gothard site. Do you know what I'm talking about?
Yes, ma'am. So,
okay, is that going to continue, or what's the status?
Okay,
and if so, how do people sign up?
Sure. No, thank you. So what happened? We had 3 sites that the firefighters are in the 1A category, firefighter, paramedics, EMTs, to get vaccinated. So because we have firefighter paramedics who can give the vaccines per the state, we established 3 locations for our first responders. We call it CNET or Gothard Station Central Net. We have First Net, which is in Anaheim, across from Anaheim Stadium, and Orange County Fire Authority, which is in Irvine. And so those 3 sites were set up to vaccinate fire and police, and they're in the 1A category. We set those up pretty early in the beginning. We were able to receive our shipments of vaccine, and we started to vaccinate our people. And one of our battalion chiefs in charge of EMS, Chief Lopez, kind of designed this whole system. And as a result, we were vaccinating that, and while we were doing that, the hospitals were vaccinating their 1A hospital staff. We hadn't got to 65 or older yet. And so when the county came in to review our process, they really liked the way we were doing it. They liked the setup we had and the process. And they said, hey, can your 3 sites that the firefighters are using, can you help us bridge to the super site? And can you start doing the public and finishing off the 1A category? And we might start having 65 and older in that category. Can you help us bridge until we get the Anaheim site set up, or Disneyland and now SoCa is set up? And so, because they wanted to get needles in arms as fast as they could. So of course, we were, that's why we're here. So we're happy to do that. We vaccinated 10,000 people at the Central Net site in a 12-day period. And then they shut those 3 sites down in order to push everybody to Disneyland and then SoCa. So the idea from the county was that they would have these super pod sites. And so that they have Disneyland and SoCa now. Now, remember, the county's only receiving about 45,000 vaccines a week, which isn't obviously enough. We have 3 million people in Orange County. The goal for them is to have everybody who wants a vaccination to be done by January 4th, which is called Operation Independence. And so they want to, July 4th. So everybody by July 4th that wants it will receive a vaccine. And that's their goal that they've set. So now that what they did is they opened up those 3 sites for us to bridge. That was for us to just start getting needles in arms as fast as we could into the 1A category. And then now they moved to super sites. So Gothard will be done, like police officers and firefighters will probably finish off at that site. But everybody else will go to the super sites. And believe it or not, the super sites
I'm sorry, go ahead.
The super sites are actually better designed. One of the things that we found is that one of the things that the county did initially was they said, look, we'll take walk-ups over 75. We were so inundated with people that we had long lines of people showing up. So if their appointment time in Athena was 3 o'clock, they would show up at 5 in the morning because they were so worried about getting it. And then they're in line for hours, and some are over 75, some are over 80. It's just, our site was really not designed to handle that amount of that flow and traffic. And so by the time we got a few days into it, we were able to kind of better design it. We were asking people to go home if their appointment's at 3, come back at 2:30 and you'll be fine. And once we got that message out, it started to move a little better. But our site requires almost 3 times the employees to run as the super site does to run the same amount of people. So even though it may not feel like it right now, it is a more efficient process at the bigger sites. Once we start getting, I wanted to touch on this and thank you for reminding me, is that what Dr. Solomon said was So initially, as you know, the vaccine came out. Once it was approved by FDA, it was shipped within a couple of days. And part of that process was the federal government was really backing the Pfizer and Moderna for you develop it as you're developing it so we could ship it out faster. So they weren't waiting for approval to start all the shipments and get everything going so we could get needles in arms quicker. But when it got shipped out to the states, it got sent out and there wasn't really any direction federally on how they wanted it done. They left it to the states. There's a lot of counties in the states. So every state was trying to do it the way that would make the most sense for their state. And it rolled out radically different everywhere in the country. And now we've gotten a lot more refined at how to do it. And so in the beginning, we had more vaccine and the process wasn't efficient enough to get needles in arms in the beginning. So we had extra vaccine and we were vaccinating. Now the process is a lot more efficient. The systems are set up, everything's moving, and now we don't have enough vaccine. So we've outpaced the vaccine dose, which in essence is kind of intuitive as it goes through the process. And now as the vaccine doses start to increase, which I suspect they will here soon, that we have the system in play to react much faster and to get needles in arms a lot quicker. I know the Athena app is a little bit frustrating. I totally understand that. We've heard a lot of calls for that, to say the least. What I think the county's trying to do is they're trying to open it up, get people registered and get appointments. But I think they're trying to avoid the fact that I don't want to say they close it, but they kind of close the app until they can process the appointments, because they don't want you to have to log in and do an appointment in September, right? Because if they open it up to everybody over 65, you would be putting appointments in next year. And the reality is, as more vaccines come in, they're going to be open up more appointments. And as they get the vaccines, they'll open up more. And then as much as it's difficult, you just have to keep checking back in order to get your appointment to put in there. And so I think they're going to get better at that as well, and how that's going to move and work going forward.
I appreciate that follow-up on that question. I'm also serve on the board for the Huntington Beach Council on Aging, and I'm getting tons of calls from Huntington Beach seniors about this, and as most specifically those who are not ambulatory and not tech savvy. So that's why I was hoping maybe Gothard had a little bit of hope for us, but I do understand that you honestly don't have control over who gets to go where. It's really the county's decision. So thank you for that answer though.
No, and I think the county's intending on setting up like these mini pods or mini sites. They are looking to do that also with their primary doctor. The one thing that the county has recommended is, if you are non-ambulatory, if you are at a point where you can contact your doctor and ask them how to do that. I believe that over time, very, very shortly, doctor's offices and CVS, Walgreens, those places will also have it and be able to process it. And I think that some of those smaller sites, they're more individualized, like when you go get your flu shot. I think that'll eventually how it'll roll out. It's just getting that network in play to be able to do that. And I think a lot of seniors will be able to use more of their local connection to do that. And I'm hopeful that we'll start to see more of that in the next coming weeks to months.
Great, Chief. Thank you very much. Looks like that's it for our questions, unless somebody else had something that they wanted to bring up last minute. I want to be cognizant of everybody's time.
Catherine Leverser has a question she put in the chat. She's asking, it would be nice if there was a waiting list and when available, people would be push notification of availability.
Yeah, that's a great idea. We talk to Athena pretty regularly. I'll talk to Lopez and have him push that question up to them.
Thank you.
It's just very frustrating to keep checking that Athena app, and it's nothing available. And plus, I would be, I'd be willing to let other people go ahead that have more exposure. I'm fortunate enough to stay at home and avoid contact, but it still would be nice to have a waiting list where they would call you.
I agree.
Thank you. Thank you, Chief Haverly.
John, I don't know if Vena's iPhone, if they have a question. Nope. I don't know who that is.
Okay. Thank you very much, Chief. With that, I think we're done with our speakers. I just wanted a couple announcements. Remember, talk to us if there's other topics you would like us to look at for either our B2Bs or our AM Connects. We're here for you. So let us know what those topics are, and we'll see what we can do to have some of those in our upcoming events. Speaking of our upcoming events, we have our next AM Connect is on the 12th of February. That will be looking at nonprofits. So Debbie, I don't know if you signed up for that, but you might want to contact us and see you can get your infomercial out, Debbie Waynes, about that. We have our Share the Love coming up, so you can register at the HB Chamber. Tina, I don't know if you wanted to talk about anything with that one.
Yes, I have probably about 3 more slots available for nonprofits to speak. There'll be a 5-minute presentation, and I know that Maureen has signed up, and I do have
like to.
But Debbie, okay. So
Yeah,
just
I
send me an
didn't know
email,
anything about
Debbie.
it, so,
Okay.
yeah.
So it'll be nice, and we also hoping to have Mercy House, also the Navigational Center, someone from them to speak and give us some information about that. So it should be a wonderful virtual AM Connected. Share the love, because it's Valentine's week.
We're also going to be sending out notices about upcoming committees we're looking at forming for our events. This will be for the state of the county, for the golf tournament we're hoping to do this summer, a gala at the end of the year. So if you're interested and you would like to participate in that, please respond back to us, let us know. And lastly, the Best of Huntington Beach, we're now looking at Friday, March 26th for that event, and that will be held here at our back parking lot of the Huntington Beach Wetlands Conservancy. So we're looking to set that up, and that's the date we've chosen so far. So please keep that open. You'll be getting more information from us as we get close to the date for that event.
And it will be a drive-in, so we will be how we did the summer nights. So we'll be with the cars.
And we'll just utilize every other parking space like we did for the event.
Who do I contact that I want to be involved in that conversation?
Send it to me, Tina.
Tina, okay, thank you.
Perfect.
Great. Well, that's all we have for today. So I want to thank you very much for being on the call. Very informative information, and we will get this information out. I forgot to mention at the beginning that we're taping this, like we are taping all of our events nowadays. We'll also try to get this and post this onto our website so you can have access to that if you need be. All right. Thank you very much, everybody, and have a good rest of your day.
Thank you everyone for joining us today.